Hi, I'm Katrina Anderson. I'm a clinical psychologist and director of the Aged Care Evaluation Unit, which is a research unit within the Southern New South Wales Local Health District. The purpose of the ACU is to design, oversee and evaluate clinically oriented research projects with the aim of reducing distress in people with dementia and those who care for them. We recently conducted a systematic literature review to look at the effectiveness of staff interventions in providing and maintaining better quality of care and quality of life for residents. Common sense suggests and research indicates that there are links between staff factors and the quality of life for residents, with poor care increasing resident suffering. However, what we don't have is a coherent picture of which staff interventions improve quality of care and quality of life for residents. From a comprehensive search of the published peer-reviewed literature from the last 20 years, only 44 studies met our inclusion criteria. Conclusions from this limited data are further compromised because about a quarter of the studies failed to look at effects on residents and only half looked at the effects after the project team withdrew. From those that did, there were some excellent studies that produced change over the medium to longer term, but they were certainly within the minority. Furthermore, many of the studies failed to measure quality of care effects, thereby limiting any conclusions that we can make about the mechanisms underlying change. The type of intervention required seemed to depend on the target that we were looking at. So for things like restraint use, structured education programs with some support appear adequate. But for more complicated issues like challenging behaviours, long-term detailed on-site support appears to be required.